Good morning and welcome to GMU Agenda, where we look at an issue of national concern. And today, we're going to be looking at diagnosis of heart disease. When we talk of heart disease, well, to some it might seem or sound complicated and maybe something very far away from you. Some people associate it with age, others lifestyle, and a lot of that. But in the studios, I have a team of people with whom we are going to be discussing diagnosis of heart disease, including modern technology that can be used to diagnose this problem. With me is Dr. Sesanga Arthur. Doctor, you're most welcome to the show.
Thank you very much, and good morning, viewers. Nice to be here with you.
And we also have, that is Hadas Mandel from LevMed. She is visiting this country, but also having something very important and relevant to the treatment and diagnosing heart diseases. Welcome to the show. Welcome to Uganda and welcome to the show.
Good morning. I'm happy to be in Uganda and thank you for having me on the show as well.
Well, when we talk of heart diseases or heart complications and problems, one of the things someone might look at, this, according to World Health Organization, is actually the #1 killer of people globally. I was looking at some of the statistics right from 2014, where you find that at one point we had 38 million deaths. That is in 2014. Then we even go to 100 plus deaths in 2015. The number keeps on increasing. A doctor, to begin with you, when we talk about heart diseases, how big is the problem in Uganda, our motherland?
Okay, thank you very much. And heart diseases are quite something that is rising up in the country. It's getting more of a killer in our people, but even a problem, what we refer to as the morbidity and also the mortality. Interestingly, like you've shared, globally, it's the world-class killer, you would say. In Uganda, it's rising up to the extent that in the 2014 WHO statistics, stroke, which is one of the other heart disease, okay? Because when we talk about heart disease, technically we're referring to what are called cardiovascular diseases, and they include vessels that supply the different parts of the body, the heart itself, yes, but also the vessels that supply the heart once affected. Also, we're talking about the vessels that supply the brain. Those are included in that. The vessels that supply the rest of the body, like the peripheral systems, including your legs and arms. All those are included in the cardiovascular diseases. So one of them, stroke, amongst the other things, and even coronary artery disease. Those are the vessels that supply the actual heart. Is one of the leading causes of death, among the top 10 causes of death in Uganda by 2014. The figures might change, so Uganda Heart Institute should be able to eventually produce another event of what happens. But the Ministry of Health has also had some check in the countrywide, and they had figures as the prevalence, how much it is in the population, in the figures of close to 30% of the population has a cardiac-related disease. So whether it's hypertension or coronary artery disease, or people have had stroke, or any other thing that's related to cardiovascular disease. So that's the magnitude of the problem, and that seems to be growing every year.
One of the challenges of treating cardiovascular diseases is diagnosing these diseases, finding out if a person really has this disease. And it is expensive and at times not readily available. For example, doctor, in Uganda, how is it easy for me to walk in a health facility and have a check?
Ideally, it's quite many prongs that you're looking at when you're referring to going for a cardiac check. And technically, we don't only say have your heart checked. We say generally, because there are other things. For example, in cardiovascular diseases, we're also thinking about things like diabetes. Okay, so a lot of other checks will be involved other than just running a cardiovascular check. But narrowing it down to heart diseases, it's quite expensive, truth be told, for someone to do a cardiovascular check because of the equipment that conventionally are used. A lot of them are quite expensive, and also they might not be readily available across everywhere. It even becomes harder in the rural areas. I know the government has fought and made sure at the primary healthcare levels, at least cardiac diseases can easily be picked up, but it's not as readily available as other things, like the way you say, I'm going to have a check for malaria. Yes, those are easier to run than the heart diseases and their diagnosis.
Hadass, here you saw you're in Uganda and you seem to have a solution to how best we can do it in a more effective way, friendly way, and maybe a bit cost effective. What have you come with to this great country, Uganda?
Okay. So Dr. Arthur was talking about the diagnosis of heart disease, and one of the basic products, the basic medical devices used in order to diagnose heart disease is called ECG, electrocardiogram. What we can see now on the screen is actually our solution, which is very simple to use. When you do an ECG assessment, when you assess the electrical activity of the heart, there are two main challenges. The first challenge is the application of the electrodes that have to be used, which in the traditional method was very complicated, hard to apply, you needed a professional and so on. But like you can see in this video, with our ECG belt that we just saw, it is very simple to use and anyone can do it after a very, very short training. The other challenge when testing the electrical activity of the heart is the interpretation of the result, which requires a physician or a cardiologist. So the specialists would be in the heart institution, for example. They cannot be everywhere all the time. So with our solution, after doing the assessment, that can be done again by anyone, the application itself on the patient, the results can be simply sent by email to a professional for interpretation. So basically we are solving both of the challenges that existed until now.
The scarcity of a doctor, of a physician, you can see the image, that is the machine on your screen, very portable, and then you get the results will be on your phone. Just send them to an expert, a physician somewhere, if not present at the moment, and the physician, person like Dr. Arthur here, will interpret these results, and then they will tell you what the problem is and you can commence treatment there. Make life simple, diagnosing heart diseases very easy in our country today if you have such technologies. Well, this technology is rare in Uganda, but how easily can we have this in our country?
It's very easy. That's the reason I am here.
Let's look at what we've been using previously to compare. You were in Chitovu Hospital. I happened to read sometime back in the papers, and that was it July last year?
Yes.
Well, when you read a newspaper, sometimes you can't recall, but at least around that time in July.
Exactly.
When we saw this first technology in the papers and on the media, and it worked effectively. But what are we having if you are to compare the two?
So in the past or currently, the traditional ECG devices, they are expensive first. They are very big, so they are difficult to move from one place to the other. They also require a lot of consumables, disposables, electrodes and gel, and you need to shave the patient. So it requires a lot of costs and purchase to be done ongoing. So these are the traditional devices that we see now that are very big. And we also see the electrodes there and all the wires. So other than the fact that it is expensive and hard to obtain the disposables, it also required a professional physician to actually do the assessment, which makes it even more costly and more difficult to do. And with our product, which we have brought into the country, we started, like you said, in Kitovu Hospital, which was an amazing also personal experience for me to stay there and work with the team and learn how things go. We started working there, and they actually went from doing 1 ECG assessment per month to about 200 per month. Now, as you can see, we are working in Kampala. These are the team from IMC, Dr. Arthur's team, and they have started using the product in many of their clinics in Kampala and also out of Kampala, up country, correct. And we have also started working, these are the team from Bugolobi, we started working in case, in the surgery. So as you can hear, we started working in the private sector. And now our goal and hope and the reason I am here for is to try and take forward a collaboration also with the government and the public sector. We started some discussions with the Heart Institute, and I hope that we can find the right way to work together. I think that the goal is because our product can allow ECG screening, heart screening to be done anywhere by anyone, the goal is to really take it out to the public, to have everyone in Uganda, in East Africa, be able to be screened for heart problems, no matter where they are.
Dr. Arthur, how does really this product work? Because we need effective solutions. We know the world is running away from bulky equipment that sometimes not even very effective in terms of how many people it can work on a day. If you look at one person a month and then you got 200 people a month, then that is big a number. But how easy is it to use such? Because this is medicine, this is life.
That's very true, and that's why the LevMed team, where Hadassah is a partner, devised something that is very simple, something that can be used by anyone. I can train you with that ECG belt on how to apply it. You might not be able to interpret, that is my role to do, but that is how simple it can be. At the moment where the Parliament Health Week, which is running throughout this week, has that ECG belt being done. So you can see we can even take it to any outreach, to the communities. We can go with that belt. All you need is someone trained very well on how to apply, but that takes like 30 minutes of training on how to apply, because it's very simple solution, and then the interpretation can be done by us. So that's how simple and easy this machine has been. So we've not like given up on the professional role of making sure it's a perfectly done procedure, but all we're doing is we're making it easier. You don't have as many, for example, cardiologists in the country, or leave alone even the doctors on their own. They're very few. But once we have such a device that can transmit the information to the doctors to interpret and help in the management of patients, that's going to make heart disease diagnosis and its management simpler.
Currently, many patients with heart diseases, well, a few, is it make it? Is it we wonder a heart problem, cardiac vesicular problems? Are they a direct ticket to maybe sharing a cup of tea with the creator, just to sound that word decent enough not to scare our morning viewer? Where is the problem in our country? Once someone has been diagnosed, hope, people kind of lose hope.
What has been happening previously is that we've been having late diagnosis of this condition. So you find that the people who have been caught at that level already are Uganda Heart Institute that's a tertiary level. That's at the top of management where they're going to do those very complicated procedures to help with the cardiac diseases. Now, LevMed has come with this ECG belt, and at the primary healthcare level at which we're working, we are starting to capture, our intention is to capture the disease before it goes to the level where the tertiary hospitals or centers like Uganda Heart Institute will be managing them. Inevitably, you have those who will need that level of intervention, but if we can catch it earlier, And with the fact that now we can move out into the community, like Hadassah said, we have the ECGs in all the IMCs, that's in Gulu, Jinja, Mbale, Mbarara, Entebbe Road. All those are places where someone can access an ECG belt. At the moment, it's actually running as a free product to give back to our community. So we want that to be something that the public can access. But we've had discussions with even the Ministry of Health and the Uganda Heart Institute itself in regard to the ECG belt. Indeed, that's something that many places are going to be moving out to the community, capturing the heart diseases before they get to a terrible level, and then we arrest the situation. That should help so that we have less and less problems of people being diagnosed and then they are dying, because that's a late diagnosis. Now we're going to be capturing the heart diseases early enough. Of course, that's also going to impact on the, we're not sure, but it might impact on the level at which the prevalence, the amount of heart diseases we have. It's possible and more likely that we've been missing a lot, and once we roll this out, once it's out in the community, we might see more figures coming up.
Hadassah, I want us to look at the level of sensitization, or level of awareness among Ugandans, your time in Uganda regarding heart problems. How knowledgeable are we and informed are we? You're in Chitovu, you've been around.
So, of course, all the medical professionals, the healthcare providers are, of course, well aware. And you have the Uganda Heart Institute with the leading professionals there, cardiologists and so on. So there is awareness on the high level. From discussion that I've had with the general population, I think there is not sufficient awareness to heart disease, to the causes, and how it can be prevented. So while I'm here with our product, which is focused on diagnosis, it is clear for me and for my partners here that one of the things that need to be done is to raise awareness also for the prevention, because prevention can start with a certain lifestyle. It can start with the type of food that you decide to eat or not to eat. It can start with going out and doing some exercise. So I think that other than diagnosis, which is super important, because if you diagnose in a timely manner, if you diagnose early, you can prevent devastating outcomes, and you can prevent the patient from getting to a point that he needs to go to the Heart Institute, for example, for a major procedure. But there are also methods of prevention that we believe should be established, should be done. And actually, I think that a show like this is a good opportunity to talk about it. Is a very, very good start. And I hope that we will also have, again, the more public government officials join us in this and help us take it forward to the public.
Doctor, cancer and heart diseases, there aren't a single cause that you can attribute this to. But maybe briefly to our viewer, what is the leading cause of heart problems?
Of course, heart diseases are categorized differently. There are those that are congenital, that people will be born with, okay? So those are part of it. But the more common ones currently that we see are the acquired. And those are mainly related to lifestyle conditions, okay? They're what, like Hadassah has already hinted, is what we're eating. We're eating a lot. Our diets have changed. We're eating less fruit, less vegetables, and more fried foods, for example. That predisposes us to a lot of heart diseases. So we need to work on, for example, our diet, make sure we're taking plenty of vegetables, plenty of fruits, but also things like exercising. We need to have the people exercise. The people need to know that I need to exercise at least 30 to 45 minutes every day of a 5 days in a week is a good thing to do. And now, like I'm sure when you're moving from here to Parliament, you're going to catch a border just at the gate to get to Parliament. Yet you could have walked all the way to Parliament. That's a good one. You can do exercise, even the simple things that we do. If I'm moving downtown, do I have to pick a border to get to downtown? Why don't I just take a brisk walk up to down there? So those are the changes that have changed. We have a lot of cars. You come in a taxi, you're seated in an air-conditioned office. So a lot of time we're not doing exercise, and you find that people are getting more of that. The other thing is smoking and also use of alcohol in plenty. All those are things that are putting our population at a risk. And so we've got to intervene. We've got to reduce on the smoking for the community, alcohol use, plenty of exercise as much as you can, and also making sure we're eating healthy, so plenty of vegetables and fruits, and away from the fried foods and the fast foods that are trending these days.
Well, Hadas, one of the challenges we have in Uganda is the culture of walking to a health facility and ensure someone does a body check is not part of us. You know, either we would save money, but even the rich, those that we think are what to do, rarely do medical checkups. Well, what advice do you have to Ugandans? We see it as a luxury, or maybe for the rich, not the ordinary Ugandan? So
I believe the goal should be to have people do routine checkups on a continuous basis. Of course, this requires, I believe, two sides to be involved here. First of all, it's the awareness of the public and the need to go and do these checkups and so on. But they also have to be available to the public in also a cost that is affordable. So I think, yeah, there is a process that needs to be done here. I can tell you just as an example, in Israel, after a certain age, after 45, you have to do an annual checkup. Or even children who do any type of sport activities have to undergo an ECG assessment once a year in order to see that everything is okay. Or before you do a marathon, you also have to do an ECG assessment. So I think that,
so that is in Israel, 45 annually. In a regular sports person,
you also have to do an ECG assessment, specifically actually children. And when we have our marathons 2 or 3 times a year, like you had the MTN marathon here a while ago, right? Then all the participants have to undergo an ECG assessment before that in order to ensure that the heart activity is okay. So it has two sides here, both the awareness of the public, but also the healthcare providers, and how we can combine both to allow more routine screening.
Dr. Arthur, as we come to the end of this show, what is your last message to Ugandans regarding cardiac diseases?
Heart diseases come so silent. You might not have any early symptoms majority of the time, and that's why, like you rightfully said, it's people get at the end when the condition is taking them to meet the creator, like you put it. So heart diseases need to be diagnosed in good time, and that's why it's important that everyone gets screened for heart diseases, so that intervention. Ideally, if you've had a check once in a year, that's typically what we call a wellness check. At least once in a year. Now, it's important, the determinant of how frequent the subsequent checks will be on what was caught on the first time. So if it was a clear one, the doctor will tell you we'll do another check in a year. If there was something to follow up, it might be in 6 months, or sometimes, depending on the other conditions, might say in 3 months. So it depends on what is found on the first time, on the first contact. But it is important that everyone has at least a health check once in a year, even if you're very healthy.
As we come to the end of this show, what is your last word to the public that is watching?
Wow. First of all, again, thank you for being here. I enjoy every second I have in Uganda, also on a personal level. So it's an amazing experience for me. And I think that our goal now would be to have as many people join us in our activities to increase access to everyone to awareness, prevention, diagnosis, and treatment of cardiac disease. So anyone watching us now and can take part and help us promote this, we're here. and we're happy to work together and partner.
Well, it's been a pleasure having you, that is Hadass and Dr. Sesanga there. We've been looking at treatment of heart diseases. Well, make sure you have a checkup once in a year or depending on the results of the report, but don't wait to be ill, then you go for treatment. At times it might be too late for you to get a remedy or cure for this disease. You either have to live for a long time on treatment, which could be costly and also very inconveniencing, or have a cup with the Creator. From me and the rest of the team, God bless you.